I'm back. I chopped all my hair off. I do have some butternut squash and pepper roasting in there, so you can ignore that. But I got a question on my last video, which I thought was a really excellent question, and it was just asking what I learned and what we covered in my classes last semester. And I think my goal was to do this anyway. I can't really keep track anymore because I made a video at the beginning of the semester talking about the different classes that I was taking, my expectations, and just giving you the overall course description of each class. So it would be really nice to kind of come back around and give you a more conclusive statement about the things that we covered. Okay, so I have a list on my phone, so I will be referencing my phone. Starting with our Fundamentals of Nursing Practice class. This was also called Science of Nursing Practice. This class had a didactic portion and then also a lab portion. So we had 2 hours of lab every week for this class. And then we had this class once a week for about 4 hours, I believe. So this was a very interesting class because it was like challenging and not at the same time. It was really weird. And I've never taken a class like this. So we were learning basic nursing things, but it mostly took on the lens of critical thinking and just priority interventions within the nursing scope, which of course is all very new to, I would say, most of us in this program. We did learn some technical things like the degrees of elevation for the head of the bed for certain patients that might have surgeries or tube placements, etc. We covered skin pretty in depth, so there are a lot of pressure sores and injuries that occur in the hospital setting from prolonged immobilization basically, and they can be extremely detrimental to patients, especially because, I don't know, at least now for me, having been in clinical week after week for a little while, most of my patients that I'm caring for have chronic diseases like diabetes that would put them at a higher risk for things like infection, that just like it really quickly goes bad, and it's really unfortunate. So we learned a little bit about preventing pressure sores, but then also learning how to care for them if they do happen and they weren't prevented. We also learned about asepsis and PPE, personal protective equipment. So we learned how to don and doff, which is just a medical way of saying put on and remove gowns and gloves and goggles and masks, and how to maintain cleanliness and contaminate as little as possible when removing things, when to do it when you're entering like a contact room, for example. We also learned body mechanics for ourselves because nursing is a very physical job and it's very physically demanding. So knowing how to properly move is really important to preserve our own well-being. Right along with that, we learned about the use of assistive devices for transfers and such, so Hoyers, how to safely have a patient fall if they're ambulating, and that just means walking, and you see that they're going to fall and you're with them, knowing how to bring them down to the floor in a safe manner for both the patient and yourself. We learned about perioperative protocols, so everything from before an operation occurs, so like witnessing the signing of consent forms, making sure that the family and the patient is understanding the procedure and possible complications, risks associated, also benefits associated with the intervention, and then everything that occurs during the surgical procedure and what a OR nurse might have to do, and then also care for the patient post-op. We learned about bowel and urine elimination, so things like enemas, methods of collection, removing impacted stool, and then also just like helping patients go who aren't able to get up and walk to the bathroom. the use of bedpans, all that kind of stuff. We also learned a little bit about ostomy care, different kinds of ostomies, why they're needed. We learned about fluid imbalances and administration of different fluids, so like isotonic fluids, hypertonic, hypotonic, and the different indications for each of those. We learned about labs, so we kind of went in depth with important normal lab values and what it might mean if some values are high or low. We learned about imaging, so all the different kinds of imaging that there are, CTs, X-rays, MRIs, which uses radiation, which might use a dye for contrast, what might be safe for certain patients, and not safe for other patients. We learned about range of motion and mobility and how important these things are to always assess range of motion in patients because they can deteriorate pretty quickly, and staying on top of that progression and intervening is really important. We learned about culture and therapeutic communication, so how different cultures might have different belief systems about the causes of disease and how to treat disease. That looks really good, I'm excited. What else? We learned about complementary and alternative therapies, so Reiki, yoga, guided imagery, all that kind of stuff, meditation. We learned about death and the nursing process around death, also grieving and how to involve the family and kind of guide them through that process. The importance of advance directives, especially at a time of death. Healthcare proxies and all the other legal things that go into making healthcare decisions for our loved ones. So yeah, I mean, it was a pretty robust selection of things that we covered. In the lab, we did most of those things. Let me see if there's anything totally different. So I have like bedpans, bed bath, changing linens while the patient is still on the bed, patient safety. Some of the skills that we did were things like central line dressing changes. So these are lines that go directly into the heart. So they are extremely susceptible to infections, and those infections could be fatal because it's going straight to the heart. Same goes for Foley catheter insertion, so that's a line that goes straight into the bladder, and you really have to follow sterile protocol to prevent infections in the bladder, which can quickly become systemic. We learned about oxygen delivery methods. I think I touched on that in the lecture part of it, but we learned a little bit more about like what a nasal cannula looks like and how to apply it, a partial non-rebreather, a Venturi mask, a tent, all these kinds of things. We also learned a little bit about what is this called? Nebulizers and how to administer that. We learned some trach care, so mainly how to change the dressing, and then suctioning as well, which I have since seen in the hospital, and it's really scary. There's like so many noises. It's like jarring a little bit. I'm sure I'll get used to it maybe. We learned a nasogastric tube placement. We actually only saw a demonstration, but we didn't actually get to do it, so I think that might be something to practice this time around in open lab. We learned about tube feeding that goes directly into the stomach, so a PEG tube via the kangaroo pump. And since being in the hospital, I have also seen that. The nurse that I was paired with a couple of weeks ago administered vitamins through the PEG tube, and that was really cool. We learned how to prime and start an IV line. It still confuses me, and I think I need to practice that still. We learned about medication administration, so different routes, but we mainly did oral sub-Q injections, which just goes like into the fat, and then intramuscular injections. We also did wound care, so that's also something that has to be done really carefully so as to not spread infections, and I've also seen this done in the hospital. We learned how to measure the wound, how to tell if there was like stenting. There are all these different technical things. I'm not going to get into it, but we did learn all about wounds. We also learned a little bit about ostomy care. It was also mainly a demonstration, and we got to just like see the different pouches and the different sizes depending on the stoma, which is the little part of the intestine that sticks out. We also learned how to assess it and make sure that it's doing okay. And yeah, we learned how to put on sterile gloves, which is a bit of a procedure. Okay, moving on. Physical assessment class. This one also had a lab attached to it, so we did 2 hours a week of lab for this class and 4 hours of lecture as well, I believe, per week. So this class was more a little anatomy based, and then mostly it was just learning how to assess different body systems and what is normal, what is not normal, and how to document it all. So I don't know, I found this class extremely enjoyable, but it seems to go one way or another. A lot of people that I've spoken to hated it, didn't do as well. In their words, I don't actually know what anyone got on their grades or anything. And then there's the others of us that really enjoyed it. It was like one of our best classes, and I don't know, it was just fun. It just takes a lot of repetition, like a lot of going over the material over and over again. So we learned about general surveys, so being able to just look at the patient and get an overview of their state, learning how to interview them, learning about different signs, symptoms, what's objective, what's subjective, all for documentation purposes. And then some of the technical things that we learned were things like vital signs, skin, hair, nails, head, neck, eyes, ears, nose, mouth, throat, thorax, breast, chest, cardiovascular, peripheral vascular systems, abdomen, musculoskeletal, neuro, genitalia, and rectum. Those were all the body systems that we covered. And literally it was just that, like assessing them, knowing what's normal and what deviates from normal, whether it's an okay deviation or a concerning one. In the lab, some of the things that we did hands-on were taking vitals. We did head and face assessments, neck assessments, which included like feeling for the trachea, feeling for the thyroid. We learned how to palpate lymph nodes. We did a thoracic examination, so that was actually what our midterm was, being able to do a full thoracic, chest, back, lung assessment on a pretend patient. Breast examinations, we did those on mannequins. Everything else we did on one another. We had like lab partners, so it was just other students doing it on other students. Heart, we learned how to assess for murmurs or thrills or gallops. We did abdomen, so feeling for the kidney, feeling for the spleen, feeling for the liver. And then also just like listening to bowel sounds and making sure everything sounds normal. We did musculoskeletal assessments, so we learned about like range of motion, testing range of motion, testing strength, all that kind of stuff. And then neuro was assessing a bunch of different parts to make sure that all the nerves were intact. So that was really cool. I really, really enjoyed my physical assessment class. And there is the expectation that we do these assessments, not a full head to toe, which by the way was our final. We had to do a full head to toe 45-minute exam on a pretend patient. But what I was saying is that the expectation is that we do more focused assessments, which just means like a certain body part or body system that might be affected on patients in the hospital during our clinical days. Moving on to pharmacology, this was actually one of my favorite classes as well. I found it to be so enjoyable, but it is an extremely dense class. So this is not one that you want to fall behind in because it is extremely difficult to catch up. Trust me, I'm speaking from experience. And I don't know, it's just so fun, and the way that the content is presented by this specific professor who I think will continue teaching it for the foreseeable future. She's just fantastic. And it's hard to really summarize what we learned because it was so much, but the different, I guess, systems that we covered were the peripheral nervous system, the central nervous system, endocrine system, cardio. That was 2 weeks. That was like the longest unit, but it was also my favorite unit. Respiratory, GI, immune, and then we covered antimicrobials toward the end. So some of this class requires knowing a little bit of the pathophysiology and frankly just like disease progression, which I'm not familiar with. Many of us are not familiar with. I'm sure there are students in the program who have some sort of medical background that understand the disease processes, but our professor did a wonderful job at kind of filling in the blanks that were important to fill so that we understood the mechanism of action of the medications that we were talking about, because it's hard to know how they're acting if we don't know where they're acting and kind of why, you know. But now that we're in pathophysiology, it is all kind of coming together, though I do believe that pathos should definitely be before pharm, but that's besides the point. So yeah, learning about mechanism of action, drug metabolism, how it interacts in the body, how the body interacts with it, and that's pretty much it. Those were like the 3 main classes, though with the 2 labs included, it's actually 5 classes that were the bulk of everything. But we did have 2 other classes. So one of them was evidence-based practice, and this class wasn't super demanding, but there was a big group project that we had to do, and there were 2 exams. So, you know, sometimes group projects are not great, but we all got through it. So some of the things that we touched on were just introduction to research, why it's important, how to access it, and why it's so relevant in nursing. So I think that's really cool, because I definitely think that as things change and as things progress, it's really important for healthcare providers in general to stay on top of all of the newest research that exists for better patient outcomes. So we talked about cross-sectional studies, cohort and case control studies, experimental studies, systematic reviews and meta-analyses, qualitative research, and then clinical practice guidelines. Every week we had a guest speaker that would share about their research, and that was really cool. That was not anything that was ever tested on, but it was just really wonderful to hear about all the different research that is being done, and really kind of just like opens your mind to how diverse and vast nursing is, really. And then last but not least, we had global health equity. So let me just pull out the topical outline for the class. This class was our least demanding course. 90% of our grade was a group project. We had to do this big presentation, and then the other 10% of our grade was attendance. So we didn't have any exams, we didn't have any other assignments, and yeah, we had a bunch of like different links to articles and videos and podcasts to listen to before class to kind of be more prepared and engage in conversation about the different topics, but it was all really interesting. So we talked about global health equity, we talked about human rights, we talked about communicable diseases, non-communicable diseases, pandemics, epidemics, outbreaks of stuff. We talked about women's health. My project was actually on women's health, abortion specifically, the health of the world's children. We talked about things like gun violence. We talked about complex humanitarian crises, forced migrations, wars, and their health impact, obviously, mental well-being, and then just transforming nursing education for a global community. So all of the discussions were extremely insightful and kind of like they would ignite a lot of passion and I don't know, just like interest in doing good work for me. So yeah, that is a big overview of all the things that we talked about and learned last semester, it's so hard for it to not feel like such a blur. So a lot of the times I think that I didn't learn anything or whatever, like I can't even recall it, but then when I'm in my clinicals or when I'm learning about something in one of my classes now, I'm like, oh, I remember learning about that last semester, and it just like starts clicking together and everything starts like meshing, and it's really, really cool. Like really cool. I'm really excited about it. But yeah, I have a lot to study for now. I need to eat lunch. I'm super hungry. And yeah, I'll catch you in my next one. I hope this was helpful. Bye.